In many cases, children have bowed knees from birth up until about 2 years, and then they gradually turn into knock knees. Check out a video here that talks about knock knees if you want more information on that. But it's possible to have bowed knees as a result of something pathological. By pathological, I mean like something that is not right. So it can be as a result of rickets, it can be as a result of Blount's disease, different metabolic or hereditary conditions. All this can lead to bowed knees in children. Hi, welcome to Little Growing Bones, a YouTube channel where we talk about children's bone pathology and how to fix it. My name is Judith Nasazi, a children's bone doctor, and let's get into this. So bowed knees is something I see a lot of in my clinic. But what exactly are bowed knees? So bowed knees are knees that look like brackets, or they're literally bowed out. It's very common in children, especially around the toddler age, but for many children this corrects out as they grow. So like I mentioned earlier, bowed knees are typically a normal variation, especially in children under 2, but as they grow, these tend to correct out. However, if this persists, it's important for you to see your doctor because this could be as a result of something pathological. Therefore, understanding what is normal is crucial. And so if it seems like the bowed knees are persistent, if it seems like they are worsening, and if the child is complaining about pain or they're having difficulty with walking, then it's important for you to consult your doctor. Again, very often, bowed knees, something normal, especially under 2s. But if the bowed knees are associated with any of the following, then I would say go in and see your doctor. 1, if the bowing is looking severe. Yes, this can be subjective, but if at all the bowing looks extreme to you, please call in and see your doctor. If the child is limping, this is to be worried about. Please go in and see your doctor. If the child is complaining about knee or leg pain, it's important to also consult him. If your child is a picky eater, the bowing then could be because of a result of a deficiency they're having. So go in and see your doctor as well. And finally, if the child has bowed knees and doesn't get enough sun exposure, it's important to see your doctor as well. When you're going to see your doctor, a clinical evaluation will be done and they'll assess that child from head to toe to see if there are any things here and there that could point to other conditions. In some instances, they will request some blood tests and x-rays to see what the bones look like. Okay, now let's talk about treatment. So like I mentioned in the start, very often bowed knees are a normal variation, especially in children between 0 to 2 years. And very often as the child gets older, the bowed knees also tend to go away and then progress into something entirely different. But it is possible to have bowed knees between that age group and still it be something pathological. However, if it's not within the normal variation gap or what we call physiological gain of arm, then treatment is important. The treatment can vary from supplements to bracing or even surgery. So when you talk about supplements, it can be an array of things based on what has been found to be deficient in the child. So once the supplements are instituted, then we start to observe and see if there'll be changes. Secondly, bracing can be used in some instances, though this is very specific to certain conditions. And finally, surgery. So surgery is done in persistent or severe cases. There are 2 kinds of surgeries that are done to correct the alignment of the legs. The first one is guided growth surgery. So I created a video on guided growth surgery. I'll leave a link in the description below, and also you can check it out up here. And guided growth surgery basically means we tether the growth plate and help use that to guide the alignment of the leg back to where we want it. The other option is osteotomy. Osteotomy means we break the bone and align it the way we want it to. So if you want me to create a video on this, just let me know. Just leave a comment down below and we'll work on that. Okay. Finally, I'll leave a few practical tips for parents. 1, ensure that your child is getting a balanced diet. If you're not sure what this is, reach out to your doctor so you can get aid on this, or a nutritionist to help you draw out a good meal plan that comprises foods that provide calcium and vitamin D to your child. I have a blog article that talks about different foods that are rich in vitamin D and calcium, and I'll leave a link in the description below. But take note of different food allergies the child has, so you don't give them those foods that could actually trigger an allergy. 2, ensure the child goes out to get some sun. I know this is very dependent on the region where they stay, but well, if they can, then sure. And 3, let kids be kids, let them play, let them get enough exercise, and help build their bodies and get strong. And that's all we have for today. Thank you for watching this video. If you liked it, give it a thumbs up, and don't forget to subscribe to the channel. And until next time, keep it on Little Growing Bonds.